Welcome to the simulation program at the University of Tennessee College of Nursing. Here in the simulation program, students are given an opportunity to learn, practice, and participate in hands-on skills while also engaging in simulation experiences throughout their nursing program. Simulation is a large part of nursing clinical time during each semester and will continue to be involved in the curriculum. The simulation program within the college is located in 3 separate lab locations: the 207 Learning Lab in the main College of Nursing building, the Health Innovation Technology and Simulation Lab, or HITS Lab, in Temple Hall, and the Physical Assessment Lab in the newly renovated Facility Services Building C. All 3 labs serve a specific purpose and will be utilized during your program. These labs, combined together, create the simulation program, which is an accredited program by the Society for Simulation in Healthcare. The 207 Learning Lab is located within the College of Nursing on the 2nd floor near Student Services. This lab is used to learn hands-on tasks and skills and to teach necessary processes before the students attend clinical settings, such as their assigned hospital locations. This lab has 14 bed spaces with mannequin technology and holds a lecture area as well. The HITS Lab is located on the 2nd and basement level of Temple Hall. This lab is used for high-fidelity simulations that allow students to critically think and apply the skills and knowledge learned in the 207 Learning Lab into realistic simulations involving highly advanced mannequins or actors called standardized patients. The purpose of this lab is to perform and apply decision-making skills into a simulated environment instead of an actual clinical environment. The Physical Assessment Lab is located on the corner of UT Drive and Volunteer Boulevard near the Tennessee Recreation Center for Students, or TREX. This lab was renovated during the summer of 2018 and is currently used for learning and practice of physical assessment skills or other classes. It is equipped with assessment-style beds, mannequins, and a projector system to enhance students' learning. All 3 lab locations follow the same rules and expectations unless you are given alternate instructions for a specific activity by your course coordinator. Sessions scheduled in any lab should be treated as clinical time, therefore appropriate preparation by students is expected in addition to adherence to the following guidelines.
Preparation. Prior to your scheduled lab time, complete all pre-lab assignments, such as watching all required videos assigned by your course faculty. The lab is an experiential learning space, and you are expected to come to the lab prepared to implement what you have previously learned. If your course faculty has assigned an admission ticket, please follow your course director's instructions for the ticket. This may be to either print the ticket for entrance or show other assigned documentation.
Arrive 10 minutes before your scheduled lab time so you are scanned in, seated, and ready to go by the time lab starts. If you're going to be late, cannot meet class requirements, or will not be able to attend lab, you must contact your clinical instructor. If you have lost or your scan code has been damaged, please refer to your cohort Canvas site to reprint the scan code and replace on the back of your badge prior to lab attendance. Failure to be prepared for lab or unprofessional behavior while you are in lab may result in a student's performance improvement form, or a SPIF, being given by faculty.
Attire. Come to lab in the correct attire assigned by your clinical instructor. Please bring completed assignments, stethoscope, name badge, including scan code, pen light, blood pressure cuff, and textbook to every scheduled lab session regardless of the location. Your nursing student uniform should be worn to every lab session that occurs within the 207 Learning Lab and HITS Lab unless otherwise instructed. This includes white shoes, white socks, hair pulled back as to not interfere with patient interaction, and con lab coat. Tattoos should not be visible and must be covered. Plain white long-sleeved shirts may be worn under scrub tops with no additional writing or designs. 1 pair of post earrings may be worn. no necklaces will be permitted. Only plain ring bands are permitted. Fingernail polish is not permitted in any lab. Metal or plastic watches with a second hand must be worn to all lab experiences. Smart watches are not permitted. Refer to the student handbook for more information on dress code.
Some lab experiences, such as physical assessment labs, may require special dress code rules. Check with the course coordinator for specific dress code rules. Conduct in lab. Please place backpacks and purses in the lockers when you walk in the door within the 207 Learning Lab. Personal belongings may be kept in the classroom, at the HITS lab, and at each station within the physical assessment lab. The lab is not responsible for lost belongings. Please bring your own lock if you would like your belongings locked, as you will not have permanently assigned lockers. No drink besides water is allowed in any lab. You may have water, but please leave it at the desks or tables in all lab locations. This is to prevent spills or accidents on the mannequin technology at every lab. Pack a snack in your backpack and a drink to have during break. Please sit in the desks and chairs provided only. Do not sit on the counters in the 207 lab or the HITS lab. Do not use your cell phones in the lab at any time, unless otherwise determined by the course instructor or simulation lab staff member, or in the case of an emergency. Phones are not permitted unless by a STEM team worker for social media purposes, and their use outside of permitted break times will result in a spiff. Disruptive participants will be removed from the simulation lab. Please abide by the recover, restore, and reuse guidelines directed by the lab staff to recycle lab supplies. Recycling instructions are written during most skilled lab at every station. In addition, please follow the cleanup guidelines and instructions posted at every bed space in both the 207 Learning Lab and the Physical Assessment Lab. This ensures that each space is prepared for the next group of students to have the same learning experience. Confidentiality. You must sign the UT College of Nursing Simulation Consent confidentiality form before you participate in lab. All activities occurring at the HITS lab are video recorded. The University of Tennessee College of Nursing Simulation Consent confidentiality form provides information regarding the use of these videos for formative or summative assessment. Video recording and picture taking by students is prohibited while in the simulation lab, unless permitted by the course faculty or lab staff. Every clinical experience is carefully planned with you in mind and must remain confidential. Sharing lab experiences, lab checkoff scenarios, and other various lab activities throughout the semester with your classmates does not allow them to have the same experience. A breach of confidentiality may result in loss of privileges at the University of Tennessee College of Nursing in all lab spaces. Simulation is a time to learn, practice, develop skills, and participate in a safe environment. Adherence to the guidelines and rules will ensure that every student has the same learning experience. It is the simulation staff hope that all students participate and gain value from their lab and simulation experience while here in the College of Nursing. Simulation will not only benefit nursing students, but future patients as well.